Community engagement is about planning research, in and with the community. The research seeks to benefit. Whilst individual relationships are important, the emphasis is upon building alliances with wider communities. It is about engaging early and agreeing on mutually beneficial outcomes to support the project and beyond. The following video highlights 10 guiding principles to help you achieve this.
Do the groundwork and prepare. Be realistic and check that you have capacity and appropriate resources to support the very early design and development phase of your research. You may be eligible to apply for the RDS Public Involvement Fund. With the help of the community leaders, you can also evaluate risks and ethics specific to the groups you wish to engage, such as vulnerability, mental capacity.
Find trusted community workers or leaders who can help broker introductions with wider communities and suggest other connections which may be relevant. Be patient, it can take time to find the most appropriate people. You can find individuals via established community forums such as voluntary services, HealthWatch, local authority neighborhood teams and community health providers. It's also good to consider informal virtual groups, such as Facebook and WhatsApp.
Respect the vast knowledge and experience of community workers and leaders. It is always best to approach people as early as possible, to start negotiations and involve them as real partners to help shape the project. Remember that their priorities will be the needs and interests of their community, rather than research, and that their time is precious. So take time to find areas of mutual interest. They know their communities well, and understand the social, cultural norms and nuances. They can alert you to specific sensitivities around language and topics and access needs.
Be honest about the scope and resources and don't overpromise. When you first meet with the wider community, spend time discussing and negotiating the ground rules and parameters of the project. This process can provide opportunity to understand core values and can be kept in mind and reviewed through the project.
Be flexible about where and when you arrange meetings. Fit yourself around others and be willing to meet in community settings and adapt the timing and format to suit the needs of the people you wish to engage. Be extremely mindful of any accessibility issues and take appropriate steps to overcome these. Always build in time for informal social time and breaking bread or sharing delicious food together.
Think of ways to build in positive impact throughout your project, rather than considering impact as something that happens at the end. Reciprocity can be anything from helping community groups to think about how to evaluate their work and apply for funding, providing a talk about a subject of interest for a community event, or volunteering with regular community meetings. Think beyond the remit of your individual project and value the investment in building relationships for the longer term.
There are no shortcuts. It takes time to build one-to-one relations with the community leaders and members of their wider groups. It helps to have the capacity to maintain regular communications and follow up on all interactions, with feedback and a thank you.
Be creative and innovative about different ways to work and collaborate. Consider ways to enable communities to lead initiatives within their own groups in ways that they think will be relevant, accessible, and enjoyable. Be open to very different approaches of engaging and collaborating, which may not have clearly defined research-related outcomes other than to simply engage and stimulate conversations.
Listen attentively and be prepared to shape your research around the needs and priorities your community raise. Explore opportunities with communities for them to influence research beyond the specific remit of the project.
Showing gratitude and appreciation can never be underestimated, as most people like to know what impact they have had. It can take time to find the most effective form of communication, and in most cases various media channels are needed to ensure everyone has access.
This video showcases the Community Involvement Toolkit, which was co-produced with community partners and facilitated by the Research Design Service in the East of England, North East, and North Cumbria, South Central, and Yorkshire and Humber regions. The illustrations were created by artist Bethan Laker. To find out more, look for the toolkit on our RDS Resources site.